Hi everyone, I'm Dr. Mark Cheng and I'm here at FitNext in Lawndale. One of the things I'd like to talk about today is the rotator cuff and how you can use foam rolling to address problems in your rotator cuff. Now, because the rotator cuff is a series of muscles that sits on the shoulder blade and attaches to different parts in the upper arm, it's one of those kind of meeting points that affects a lot of other areas of the body, from the neck to the T-spine to the elbow to the wrist. So a lot of times you can have people that manifest symptoms in any of those places, such as carpal tunnelish symptoms, grip dysfunction, chronic neck pain. All of these things can, and sometimes very often do, have the rotator cuff as their root point of dysfunction. So one of the things you can do to check for rotator cuff dysfunction is to get a roller, ideally one that's nubbed like this, the rumble roller. A flat roller, because it's so smooth, doesn't allow that kind of pinpoint pressure to get into the rotator cuff the way a textured roller would. And again, like if the texture parts of the roller are too flat, they won't get into the trigger points the way they need to be gotten into for better relief. And so if you think about this, the shoulder blade, that triangle of bone here, is where the rotator cuff starts. And again, those muscles attach and feed from that shoulder blade, both the back and the front, to different points in the upper arm. To de-trigger that, sometimes you're going to find incredible relief for everything from elbow pain to wrist to neck issues. So this is a case in point. I've had many patients come in saying, like, Doc, I've had really bad elbow pain. And they've had acupuncture done, they've gotten cortisone injections, the whole 9 yards. Same thing with repeated neck stiffness or trauma in the neck. One of the things too, especially if their clinicians or therapists didn't really examine the rotator cuff, that you'll see is these problems keep resurfacing. So if you imagine someone holding your upper arm like a vice, when you try and rotate your hand, the lower muscles of the elbow and the forearm have to work harder to create that rotation of your hand against that stiffness here. Same thing with the neck. If the rotator cuff is tight, every time you move your arm, that's pulling on your shoulder blade. And your shoulder blade is also connected to your neck through your trap. So if you think about it, every time you're moving your arm, if there's excessive tension in the rotator cuff, that's also yanking on your neck. So in order to de-trigger that, one of the things we can do is get a rumble roller. This is a great roller, truly my favorite. And if you've got a larger one, you can lie right in the middle of it, place your armpit right along the roller like so, and then rock back until you're about at a 45-degree line with your torso from the ground. From here you want to relax the head and neck back and then rock back and forth, left, right, until you find that kind of trigger point, that kind of tight area in the rotator cuff that makes you kind of go, ooh. When you found that, you'll feel it because it may zing a little bit down into your arm. You may feel it up into the shoulder. You may feel it radiating in different points. Trigger points, because they're so tight, sometimes have lines of radiation where they kind of give sensations of pain along to other parts of the body. So as you're rocking back and forth, keep loose, keep breathing, let the roller do its job, and just rock back and forth until you start feeling that area loosen up. And you may even become more aware of that trigger than you were before. After having some time to roll on that and go back and forth, relax the body. Also go up and down. So change the vector of how your body relates to that trigger point. Come up, check the arm, go through ranges of motion, lift, twist, whatever. Again, you don't know whether or not you're working the right trigger unless you test it both before and after. And if it feels better after, then you're barking up the right tree. So again, to review, the triggers in the rotator cuff that we're going to get after with this particular rolling sequence are in the infraspinatus, which is one of the 4 main rotator cuff muscles. It's going to sit on the back of the shoulder blade. If you're using a smaller rubber roller, or a smaller roller in general, that's like maybe half the size, start off with your chest at the very end, at the front of the roller, and then rock back. Otherwise the roller will flip up and you'll fall off. So start with the chest at the very front of the roller, extend the arm, keep it loose, let the neck hang, and then roll back to about 45 degrees. You're not flat on your back like this, just 45. Neck is loose, and then rock up and down, and left, right. Give those progressions a try, and let me know how it goes. And for more information, you can find me at drmarkcheng.com. Thanks.